Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 39th lecture on pathology. Today, day 5 of Neoplasm. Today's topic is tumor heterogeneity, spread of malignant tumor, so today's topic is tumor heterogeneity, spread of malignant tumor. First come to tumor heterogeneity. Dear audience, suppose this is a malignant tumor in an organ. You know, the tumor is composed of a lot of malignant cells. Tumor is composed of a lot of malignant cells, or these are the anaplastic cells. And you know, the malignant cells are pleomorphic regarding their size, shape, nuclear size, shape. These are pleomorphic. Dear audience, in a malignant tumor, some cells can invade. Some cells can invade and some cells cannot invade. Again, in a malignant tumor, some cells can metastasize and some cell cannot metastasize. So, in a malignant tumor, some cells can invade, some cannot invade, some can metastasize, some cannot metastasize. This is known as tumor heterogeneity, that is, the cells are not homogeneous regarding their different characteristics, rather these are heterogeneous regarding their different characteristics. This is tumor heterogeneity. In a malignant tumor, some cells can invade, some cells cannot invade, some cells can metastasize, and some cells cannot metastasize. This is known as tumor heterogeneity. This is known as tumor heterogeneity. Now come to spread of malignant tumor. Malignant tumor can spread locally by invasion and may spread to a distant place by metastasis. So, spread by invasion and by metastasis. So, invasion locally, and this is local spread, and malignant tumor can spread to distant place by metastasis. First come to spread by invasion. It is also called spread by infiltration. Suppose this is cervix of uterus and this is the vagina. If a mother suffers from cervical carcinoma, this cervical carcinoma may infiltrate in the body of the uterus from the cervix, and this cervical carcinoma may invade the vaginal wall also. This is local spread of carcinoma of cervix by invasion or by infiltration. Now come to distant metastases. Suppose anybody suffers from carcinoma of the prostate. The cancer cells from the prostate may go to liver, may go to lungs, may go to bone and form their second tumor, that is metastatic tumor. This is distant metastasis. Now come to metastasis first. What do we mean by metastasis? Tumor implant away from the primary site to a distant place without any communication is known as metastasis. Tumor implant away from the primary site to a distant place without any communication is known as metastasis. If anybody suffers from carcinoma of the prostate, the prostatic carcinoma is the primary tumor. If the cells of the prostatic cancer go to lung and form second tumor, it is called secondary tumor or metastatic tumor, and the cancer of the prostate is here primary tumor or primary site. So, tumor implant away from the primary site to a distant place without any communication is known as metastasis. Suppose this is the urinary bladder and this is the prostate. If prostatic carcinoma here, this carcinoma cell may metastasize in the lung, or it may metastasize in the vertebral body. The malignant cells from this prostatic carcinoma may go to the lung and form their second tumor, or may go to the vertebral body and form second tumor. So, this is the secondary tumor or metastatic tumor, and this is the primary tumor. This is known as metastasis. Tumor implant away from the primary site to a distant place without any communication is known as metastases. Now come to roots of metastases. Lymphatics, hematogenous root, transcoelomic root, natural passage, surgical instrumentations. So, these are the roots of metastases of malignant tumor: lymphatics, hematogenous root, transcoelomic root, natural passage, surgical instrumentations. Dear audience, first come to lymphatics root of metastases. If a mother suffers from carcinoma of breast, I have told you in the previous lecture, carcinoma usually metastasizes through the lymphatics. This carcinoma from the breast may metastasize to the lymph node, axillary lymph node, cervical lymph node. From this carcinoma, malignant cell first enters into the lymphatics, then goes to the lymph node, This is the lymphatics. Malignant cell enters into the lymphatics and goes to the lymph node, and within the lymph node the malignant cell grows and forms second tumor in the lymph node, and there is lymphadenopathy. This is lymphatics root of metastases of malignant tumor. Now come to hematogenous root of metastases. Dear audience, I have told you in previous lecture, new blood vessels is formed, that is neovascularization occurs within the tumor. So, within the cancer, within the malignant tumor, there is neovascularization. Suppose this is a blood vessel, and this blood vessel within the malignant tumor, and these are the endothelial lining. This is the blood vessel wall. Dear audience, I have told you neovascularizations occurs within the tumor. So, if this is a blood vessel within the cancer, around the blood vessel there is a lot of malignant cells. Around the blood vessel there is a lot of anaplastic cells. Suppose these are the anaplastic cells or malignant cells of different size shapes with hyperchromatic nucleus, altered nuclear cytoplasmic ratio. These are the malignant cells, and also these are the malignant cells. So, the blood vessel is within the cancer and cancer cells around the blood vessel, and blood flows like this. Now, come to steps of vascular metastasis, steps of hematogenous metastasis. Secretion of laminin by anaplastic cell or by cancer cell. Secretion of enzymes by anaplastic cells. Entrance of malignant cell in the blood vessel. Entrance of malignant cell, that is anaplastic cell, in blood vessel. Homing of malignant cell or anaplastic cell. Homing of anaplastic cell, that is homing of malignant cell. These are the steps of hematogenous metastasis. First come to secretion of laminin. Secretion of laminin by malignant cells. Before going to discuss about the secretion of malignant cell, again we can recapitulate tumor heterogeneity. We know all cells cannot metastasize. Some cells of a cancer can metastasize. That is, a colon of malignant cell of a cancer can metastasize. So, the colon of malignant cells of a cancer that can metastasize, they secrete laminin. Laminin is secreted by a colon of anaplastic cells of malignant tumor. So, all cells of the malignant tumor cannot secrete laminin. A clone, certain cells of the cancer can secrete laminin. Laminin is like this, and it has two receptors. This is receptor, this is receptor. This laminin is secreted by the anaplastic cells, and it has got two receptors. Has two receptors, one receptor for the malignant cell, another receptor for the collagen of the blood vessel. One receptor for malignant cell and another receptor for another for collagen of blood vessel. Suppose this is the laminin, these are the laminin, this is laminin, this is laminin secreted by the malignant cells. So, it has one receptor for the malignant cell, another receptor for the collagen of the blood vessel. So, we can say laminin makes bridge between the malignant cell and collagen of the blood vessel. So, the secreted laminin, so the secreted laminin makes bridge between malignant cell and blood vessel. As it has two receptors, one for malignant cell and another for collagen of blood vessel. So, this is the laminin that makes bridge between the malignant cell and blood vessel. Now, come to secretion of enzymes by the anaplastic cells. The enzymes are collagenase, elastase, cathepsin, hyaluronidase. Etc. These are the enzymes secreted by the malignant cell. These are the enzymes secreted by the clone of cancer cells of the malignant tumor. Collagenase, it hydrolyzes collagen fiber of blood vessel. It hydrolyzes the collagen fiber of blood vessel wall. Elastase, it hydrolyzes the elastic fibers of blood vessel. Cathepsin, it destroys proteins in blood vessel wall. Hyaluronidase, it hydrolyzes the ground substance. Ground substance of blood vessel wall. Dear audience, this malignant cell secretes collagenase that hydrolyze the collagen fiber of the blood vessel. The elastase secreted by the malignant cell hydrolyze the elastic fiber of the blood vessel wall. Cathepsin secreted by the malignant cell hydrolyze the proteins. Hyaluronidase secreted by the malignant cell, it hydrolyzes the ground substance. So, the blood vessel wall become weak due to hydrolysis of collagen, due to hydrolysis of protein, due to hydrolysis of elastic fiber, due to destruction of the ground substance. Due to action of the enzymes on blood vessel wall, blood vessel becomes weak and defective. Due to hydrolytic action of the enzymes on the blood vessel wall, the blood vessel wall become weak and defective. Now come to entrance of anaplastic cell in blood vessel. Dear audience, as the blood vessel wall is weak and defective, through this point the malignant cell enters into the blood vessel. Now, the malignant cells entering through the weak point of the blood vessel is remaining in the blood of the blood vessel. These are the malignant cells or anaplastic cells that comes from the tumor through the weak point of the blood vessel wall. Anaplastic cells or malignant cells enter in blood vessel through the weak and defective part of blood vessel wall. Dear audience, now malignant cell is in blood. Now come to what are the fate of malignant cell, that is what are the fate of anaplastic cell entering into blood vessel. Fate of anaplastic cell entering in blood vessel. If the anaplastic cell first meet T lymphocyte, if the anaplastic cell first meet T lymphocyte here, suppose this is the T lymphocyte, by the cytotoxicity of this cytotoxic T cell, the anaplastic cell will be killed. So, if anaplastic cell first meet the T lymphocyte, cell is killed by the cytotoxicity of the cytotoxic T cell. Another fact, if the anaplastic cell first meet platelet, the anaplastic cell survives. Suppose these are the platelets. If the anaplastic cell first meet platelets, anaplastic cell survive. So, these are the fates of malignant cells entering into blood vessel. If it first meet the T cell, T lymphocyte, by its cytotoxic activity, malignant cell is killed. If it first meet platelet, malignant cell survives. These are the fates of malignant cell in blood vessel. Now, come to homing. Homing of malignant cell. Homing means the malignant cell is extravasated from the blood vessel in the tissue and makes a second tumor. This malignant cell extravasated in the tissue, that is, the malignant cell comes out of the blood vessel in the tissue and grow there and makes a second tumor. This is known as homing of malignant cell. Malignant cells are extravasated from blood vessel and form a second tumor in tissue. This is known as homing of malignant cell. This is homing of malignant cell. And due to homing of malignant cell, a second tumor is formed, and this second tumor is known as secondary tumor. Secondary tumor, and this is the primary tumor. This is primary tumor. This is primary tumor, and this is secondary tumor, and this is metastasis. As the secondary tumor is formed due to metastasis, the secondary tumor is also called metastatic tumor. So, it is secondary tumor or metastatic tumor. So, this is hematogenous route of metastasis. Dear audience, now come to one point where homing will occur. Where homing will occur, where second tumor will be formed, it depends upon two things. Where homing will occur depends on where homing will occur depends on one is direction of blood flow. So, this is the direction of blood flow. So, on direction of blood flow, homing of malignant cell depends. Another one, presence of receptor for malignant cell in tissue. So, where homing will occur, it also depends upon the presence of receptor for that malignant cell in tissue. So, homing depends on direction of blood flow and presence of receptor for the malignant cell in tissue. So, this is all about the hematogenous metastasis of malignant tumor. Now, come to transcoelomic route of metastasis. Dear audience, if anybody suffers from intra-abdominal malignancy, the malignant cells of intra-abdominal organ may exfoliate, and after exfoliation from the primary tumor, it can traverse through the peritoneal cavity and may form second tumor on ovary or on the urinary bladder. This is transcoelomic route of metastasis. If anybody suffers from intra-abdominal malignancy, exfoliation of malignant cells from the tumor traverses through the peritoneal cavity and form second tumor on urinary bladder or on ovary in female. This is transcoelomic route of metastasis. Dear audience, now come to example of transcoelomic route of metastasis. Krukenberg tumor is an example. Krukenberg tumor is an example of transcoelomic route of metastasis. Krukenberg tumor is the secondary tumor on the surface of the ovary. A secondary tumor on surface of ovary. This tumor comes from the carcinoma of stomach through the peritoneal cavity. It is a metastatic tumor with primary tumor is carcinoma of stomach. So, it is a metastatic tumor on the ovary with primary tumor is carcinoma of stomach, and the tumor cells exfoliates from the carcinoma of stomach and traverses through the peritoneal cavity and from secondary tumor on the surface of the ovary. tumor cell remain confined on the surface of ovary and it does not penetrate the ovary. So, tumor cells remain confined on the surface of the ovary and it does not penetrate the ovary. It is named as Krukenberg according to name of scientist Krukenberg. Named Krukenberg according to name of scientist Krukenberg. So, this is the Krukenberg tumor, an example of translumic route of metastases. Suppose this is fallopian tube with the fimbriated end and this is the ovary. If mother suffers from carcinoma of the stomach, the malignant cells from the carcinoma of the stomach may exfoliate and traverses to the peritoneal cavity and may form a second tumor on the surface of the ovary, and this is the Krukenberg tumor. Now, come to natural passage of metastases. Dear audience, suppose this is kidney and this is the urinary bladder. If anybody suffers from carcinoma in the kidney, the cancer cell may exfoliate and may come through the ureter and it may form a second tumor in the urinary bladder. This is an example of natural passage of metastasis of malignant tumor. Now, come to surgical instrumentation. Dear audience, if intra-abdominal malignancy is operated by a surgeon, the malignant cells may come along with used gloves and instruments in the incisional area, and this malignant cell may form a second tumor in the incision or in the incisional area. This is an example of surgical instrumentation associated with the metastasis of malignant tumor. Dear audience, this is all about the spread of malignant tumor, local spread by invasion and distant spread by metastases. Now, come to skip metastases. What we mean by skip metastases? During metastasis, one or more lymph node may be bypassed. Bypassing of lymph node during metastasis is called skip metastasis. Dear audience, you know tumor implant away from the primary site to a distant place without any communication is known as metastasis, and one of the route of metastasis is lymphatics. So, during metastasis through the lymphatics, if one or more lymph node is bypassed. This bypassing of one or more lymph node during metastasis is known as skip metastasis. Suppose this is the cancer, this is the cancer or malignant tumor, and these are the lymphatic channels from the organ, and this is the lymph node. Another channel from this lymph node, and this is the lymph node, and this is the channel lymphatics, and this is the lymph node. This is the lymphatic, and this is the lymph node. If there is lymphatic route of metastasis, the cancer from this primary side first come through this channel in this lymph node, and there is lymphadenopathy. Then it will come here, and there is lymphadenopathy. Then it comes here, and there is lymphadenopathy. If there is no entry of malignant cell in the first lymph node, but it is bypassed here and comes in the second lymph node. Again, if the first lymph node is bypassed and second lymph node is involved, this is known as bypassing during metastasis, and this bypassing of lymph node during metastasis is known as skip metastasis. Now come to what are the causes of skip metastasis. One is lymphangitis, if chronic lymphangitis, and there will be fibrosis, so there is chance of skip metastasis. Radiation, if anybody is exposed to radiotherapy, there is chance of development of lymphangitis and blockage of the lymphatic channel, and so there is chance of skip metastasis. Surgical intervention, if surgery is done, there is chance of losing of lymph node, chance of injury of the lymph node, chance of injury of the lymphatics. So, there is chance of skip metastasis following surgical intervention. Developmental anomalies. Developmental anomalies of the lymphatic channel or lymph node is associated with skip metastasis. Now come to importance of skip metastasis. Dear audience, now come to importance of skip metastasis. Again, bypassing of one or more lymph node during metastasis is known as skip metastasis. Dear audience, suppose first, second and third lymph node is bypassed during metastasis, and metastasis occurs in the fourth lymph node. This is the fourth lymph node. So, during examination of the patient, this distal lymph node where there is metastasis, but no metastasis in these three lymph nodes, during examination of the patient, the involved distal lymph node may be missed. So, this is the importance of skip metastasis. What is the importance? In skip metastasis, if distal lymph node is involved, the distal lymph node may be missed during examination. In skip metastasis, if distal lymph node is involved, this distal lymph node that is involved during metastasis may be missed during examination of patient. Dear audience, during examination of patient, the involved distal lymph node may be missed. This is importance of skip metastasis. Respected audience, now come to what are the causes of lymphadenopathy in malignant tumor. What are the causes of lymphadenopathy in malignant tumor? One is spread of anaplastic cells in lymph node and growth of malignant cells or anaplastic cells and lymphadenopathy. That is, if this is a lymph node like this, if malignant cells enters here, the malignant cells grow here and ultimately forms a second tumor in the lymph node. This is metastatic tumor in the lymph node. So, there is lymphadenopathy. Reactive hyperplasia. That is follicular hyperplasia. If anybody suffers from cancer in any organ, the regional lymph node may react and there is enlargement of the follicles of the lymph node. As the regional lymph node reacts, there is enlargement of the follicles. This is called follicular hyperplasia, and as a result there is lymphadenopathy. What it means? Cancer here, this is the regional lymph node like this. These are the regional lymph nodes, these are the regional lymph nodes like this, these are the regional lymph nodes like this. This lymph node reacts, there is follicular hyperplasia. These are the follicles, there will be follicular hyperplasia. As the regional lymph nodes reacts due to cancer of the organ, there is follicular hyperplasia, and due to follicular hyperplasia there is enlargement of the lymph node. So, follicular hyperplasia, that is reactive hyperplasia, is associated with lymphadenopathy. Another cause of lymphadenopathy, paracortical T cell proliferation and sinus histiocytosis in lymph node following drainage of products of cancer in node. Dear audience, you know this is the lymph node. These are the follicles like this. If from the cancer or from the malignant tumor some products of cancer enters in the lymph node, there will be paracortical T cell proliferation, and at the same time there will be sinus histiocytosis. Due to paracortical T cell proliferation and sinus histiocytosis, in response to drainage of products of cancer, there is lymphadenopathy. So, one is lymphadenopathy due to a spread of malignant cell and growth of malignant cell. Another is reactive hyperplasia, no entry of malignant cell or products of cancer in the lymph node, but there is follicular hyperplasia and lymphadenopathy. The third one, no entry of malignant cell from the cancer in the lymph node, rather some products of cancer may enter in the lymph node. So, there is paracortical T cell proliferation and sinus histiocytosis that leads to lymphadenopathy. So, these are the different causes of lymphadenopathy in malignant tumor. Dear audience, today I have told you about the tumor heterogeneity, that is, in a malignant tumor all cells are with not same characteristics. Some can metastasize, some cannot. Some can invade, some cannot invade. This is tumor heterogeneity. And I have told you a spread of malignant tumor, local spread by invasion and distant spread by metastasis. Tumor implant away from the primary site to a distant place without any communication is known as metastasis. Lymphatic route of metastasis, hematogenous route of metastasis, natural passage, transcoelomic route, surgical instrumentations. I have told you what are the steps of hematogenous route of metastasis. I have told you about the Krukenberg tumor. It is secondary tumor on the ovary. The primary was in the stomach. The speciality of the Krukenberg tumor, it remains on the surface of the ovary. It does not penetrate the ovarian tissue. I have told you about skip metastasis. What are the causes of skip metastasis? Lastly, I have briefly discussed about the causes of lymphadenopathy in malignant tumor. Today up to this, thanks all.